Children and Young People's Mental Health and Wellness, created by the Centre of Excellence, narrated by Jane Branch.
Centre of Excellence, Children and Young People's Mental Health and Wellness. Module 1. The Prevalence of Mental Health Problems in Children and Young People. Mental Health Policies and Legislation. A number of policies have been developed to try and combat the issue of the rising prevalence of children and young people's mental health problems, two being key, and will be discussed later in this module. Child and Adolescent Mental Health Services, or CAMS, are struggling to cope with the demand as the number of referrals has risen dramatically. Not only are there extremely long waiting times, but it has been reported that, on average, some CAMS are turning away a quarter of those referred for treatment. Similarly, CAMS are putting in place high thresholds for treatment, making it difficult for children and young people to access specialist support. Another issue these policies aim to address is the wide variation in expenditure on children's mental health by region. There's found to be a higher expenditure in the north compared to the south on children's mental health. Statistics around children and young people's mental health problems. Around 1 in 10 young people aged between 5 and 16 have a mental health problem. That's the equivalent of 3 in every classroom. This means that there are around 720,000 children and young people aged between 5 and 16 experiencing a mental health problem in England. Research has also reported evidence of gender differences, with boys being more likely to externalise problems, conduct and anger problems, and girls experiencing internalised conditions such as depression and anxiety. Mental health problems are linked to many long-term problems, such as having time off school or experiencing unemployment. The estimated long-term cost to the economy of mental health problems is £105 billion a year. All the data so far on children and young people's mental health is taken from the most widely used prevalence data, based on research published in 2004. The government has commissioned a new prevalence survey, but new data will not be available until 2018. This lack of up-to-date information has a serious impact on the ability of commissioners and providers to understand the current prevalence in their areas. For example, each local area has been instructed to develop a local transformation plan on children's mental health, but these are based on data which is over 10 years out of date. Is there a rise in children and young people's mental health problems? Although this data is out of date, there is some evidence that does suggest a significant rise in children's mental health problems over the last 5 years. For example, the number of young people attending A&E because of a psychiatric condition has more than doubled since 2010. Reasons for the large number of referrals to both CAMS and A&E could indicate a higher prevalence of certain conditions, for example self-harm. The increase could also be based on a reduction in the stigma surrounding mental health, which is encouraging young people and their parents to seek help, along with a higher awareness of mental health in the community. However, the lack of recent data complicates a detailed analysis of the prevalence of children and young people's mental health problems. The high and rising rates of referrals not being accepted by CAMS raises questions about the capacity of local services, the limitations placed on services by commissioners, and the interface between the service and those agencies referring to them, for example, schools, social workers and GPs. A British Psychological Society survey of mental health providers found that 89% of respondents reported an increase in referrals in the past 2 years leading up to 2014. There are also a large number of young people without a specific mental health diagnosis, but nevertheless
Sample complete. Ready to continue?